Good morning, everyone. We're just going to wait a couple more minutes and we will start at 12. Thank you. Okay, so it is 12 o'clock, so we're going to get started. Thank you all for joining today on our Friday edition of the biweekly media briefings. I just want to remind you, Brittany is away today, so I'm Sarah Gill, and I'm going to be filling in for her. And I also want to note that Dr. Salvatierra will be leaving the scrum at 12:30. She has another meeting to get to. So we're going to try and make this quick just to make sure that some of your questions are able to be answered. As always, please make sure your mics are muted, and when you're called upon, we can unmute them. So I am pleased to welcome our board chair, Andy Mitchell, joining us today, MPP Dave Smith, Mayor Diane Therrien as well, and I think we have a couple more that will probably join as we get started. So I'm going to start with our land acknowledgement. We respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rema, Beausoleil, and Regina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. And to start us off, we will have our board chair, Mayor Andy Mitchell, with some opening remarks.
Thanks, Sarah. This week has been one of progress in our community. The first vaccines have been administered, case numbers have been slowly declining, and schools have reopened. This is all good progress, but as I said in the spring, we cannot mistake progress for victory. Now, more than ever, we need to follow the provisions outlined in the state of emergency, the stay-at-home order, and the public health guidelines. As important as our individual actions are, it is what we do as a community that will protect us from COVID-19. Everyone, please remember, stay at home except for an essential activity like working, going to school, seeking medical care, or buying groceries. Do not socialize with anyone outside of your immediate household. Do not travel other than for essential purposes. This is not a time to take a vacation. When away from home, wear a mask. When with people other than our immediate family, keep a physical distance of 2 meters. Wash your hands frequently. And if you feel ill, stay home, seek medical advice, and get tested. Most people are doing all of these things. Thank you. But it is very important everyone follows the rules and guidelines. I know this last year has been challenging, for some devastating. It is heartbreaking to see the pain. I am confident, however, that together we will not only overcome COVID-19, we will renew our communities, build back better and stronger, and relish in the simple pleasure of being together. Be safe, stay well, and in all things, be kind. Thank you.
Thank you for those words, Mayor Mitchell. Now we're going to move on to Dr. Salvatierra with the situational update.
Thank you very much, Sarah. So as of 4:30 p.m. yesterday, Peterborough currently has 50 active cases. This represents 8 more than Tuesday. In total, we have reported 535 cases since the pandemic began. My team is closely following now 76 high-risk contacts, which is 4 more than Tuesday. Again, I think this reflects the positive effect that of the stay-at-home order. So even though the total number of cases has increased by 8, there are only 4 high-risk contacts associated with these new cases. So thank you, everyone, for your cooperation. Unfortunately, we have had another death in our community. So just today, it's not reported here on the slide, but we are at 8. And I wish to extend my condolences to the family members who have now lost a loved one. Next slide, please. This bar graph shows our weekly totals, and they continue to decline. Again, a very good sign. So far this week, we've reported 21 cases. We'll look at our monthly totals next, and you can see that January will be our month with the highest number of cases so far in this pandemic. We are at 188 so far, compared to 137 in December. As far as our exposures, if you look again to the right of the slide, you'll see they remain consistent. 67% of our cases are as a result of those close contacts, and community spread represents 23%. Both of those are slightly higher than on Tuesday. Next slide, please. Our gender breakdown remains the same, with females slightly more than males. And again, our age breakdown of all of our cases shows that we have 171 cases in the 20 to 29 year bracket. That's almost 3 times higher than the next highest age bracket of 50 to 59 years. Finally, we'll go to our outbreaks. We currently have 4 active outbreaks in Peterborough. 1 new outbreak has been declared at Peterborough Retirement Home since our last briefing. The other 3 are the same ones that have been reported previously at Regency of Lakefield Retirement Home, Centennial Place in Millbrook, and the A2, B2 inpatient units at PRHC. So today I would like to share some details on how the vaccine rollout is progressing in our local community. We are currently in our long-term care homes. I would also like to describe how decisions will be made to determine the order in which different groups will receive the vaccine. Last Tuesday, you asked how we will be reporting on our local vaccination rollout, so I have a few more details to share as well. I'm very pleased to tell you that residents in 4 of our local long-term care homes have now received their first dose of COVID-19 vaccine. Those homes are Fairhaven, Riverview Manor, Extendicare Lakefield, and Pleasant Meadow Manor in Norwood. So there are 2 in the city of Peterborough and 2 in the county so far. The vaccine was administered by a multi-agency team comprised of PPH staff, staff in the long-term care home, and some staff from PRHC. In total, 409 residents were immunized, as well as 43 long-term care home staff. No doses were wasted. We had 2 adverse events, one which necessitated a hospital visit, but I'm happy to report that both cases have recovered. The question I'm asked most frequently these days is, when am I going to be able to get my vaccine? It's important that our residents understand that the province has decided the order in which people will receive their vaccine, with the end goal of having enough vaccine for anyone who wants it by September. Local public health has been tasked with identifying any local priorities within that provincial sequencing framework. And we have created a local committee to oversee this, as well as helping us to create that bigger plan for all three phases of the rollout. The Peterborough Interagency Vaccine Planning Team has had 3 meetings to date, and it's comprised of representatives from different sectors across the community. Sitting at this virtual table currently are representatives from the local Indigenous communities, from long-term care homes, retirement residences, paramedics, physicians, pharmacists, the hospital and public health, city and county emergency planners, as well as Trent University. Actually, this planning table has been around for years. When there is not a pandemic in full swing, this group meets 3 to 4 times a year to organize public educational events on pandemic preparedness and to conduct tabletop exercises to keep our plans up to date and our skills well honed. This group has built strong working relationships over the years, and everyone involved deeply cares about helping our community when pandemics arise. This group has struck 3 subcommittees or working groups so far, one for vaccine sequencing, one for Indigenous vaccination planning, and a third to plan our phase 2. So if you recall here in this vaccine provincial rollout plan, phase 2 occurs when the immunization clinics will be held. So this is our mass immunization phase. It's dependent on an adequate vaccine supply. So it's hard to say exactly when these clinics will start. You'll see here, we have them starting in April. Right now, I can say they'll begin in the spring. If we get more vaccine in March, they can start earlier. I can also tell you that the Peterborough Interagency Vaccine Planning Team is committed to providing you with regular updates on the local vaccination plan, and we'll do this in many ways, such as through media briefings, in regular reports that are posted to our website and shared in social media. Speaking of regular reporting, I know many of our media colleagues are keen to learn how we will be reporting on our vaccine supply and where doses have been administered. I'm pleased to share that we have added this information to the same webpage where we report COVID-19 cases, and this will be updated weekly every Friday for now. The Ministry of Health is still refining its public vaccination reporting plan, and we will include direct links to their dashboards, which will include the numbers of local doses given. This page also has a direct link to Health Canada's vaccine safety page, where adverse reactions to the COVID-19 vaccine are being tracked. According to national data, as of January 15th, there were 602,000 doses administered in Canada, and there have been 90 adverse events following immunization reported. Of those, 63 were considered non-serious and 27 classified as serious. So I hope you found that helpful. Thank you very much, and I look forward to answering any questions. Over to you, Sarah.
Thank you so much, Dr. Salvatierra. So I'm going to move on to our elected officials. Is Chief Carr on the call and would like to say anything?
Hi, Sarah. I'm on the call, and no, I'm here to take any questions if there's any after.
Fantastic. Thank you so much. So we'll next move to MP Monsef. Is there any remarks you have today?
Hello, Sarah. Yes, I have quite a few updates, and I'd appreciate the opportunity to share that with the community. Bonjour, Anin. Salam alaikum. I'm at home in Mississauga territory and thankful for all of you and your consistent, steady leadership. The Prime Minister just provided an update to Canadians on travel, vaccines, safety of our schools, uh, racism and addressing it in our healthcare systems, gender based violence, and a National Day against Islamophobia. I'll begin with the very significant changes made to travel. As you know, we've been asking Canadians to stay home, to avoid non essential travel, because the safety of Canadians is our number one priority. Today, the Prime Minister announced that the Government of Canada has reached an agreement with the leadership of main airlines in Canada to suspend services to all sun destinations. Those are Caribbean locations in Mexico until April 30th. Thanks to Air Canada, WestJet, Sunwing, and Air Transat for their leadership on this front. The government of Canada has committed to working with airlines on future relationship between testing and quarantine requirements, which will enable a gradual, safe return of travel grounded in science and evidence. I know everybody's looking forward to the opportunity to get away, and that day will come and it will be done safely. Starting next week, all international passenger flights must land at one of four airports: Vancouver, Toronto, Calgary, and Montreal. In addition to the pre boarding tests that are already required, as soon as possible in the coming weeks, we're introducing mandatory PCR tests at the airport for people arriving to Canada. Travelers will then have to wait 3 days at their own expense at an approved hotel. Those with negative tests can quarantine at home for the full 14-day period with increased surveillance and enforcement. Positive tests will be immediately required to quarantine at designated government facilities. Regarding land borders, in the coming weeks, non essential travelers will also need to show negative tests before entering at the land border with the US. I will repeat, in the coming weeks, non essential travelers will also need to show negative tests before entering at land border with the US. We are working on additional land border requirements, and we will follow up with Canadians very quickly on that front. Less about travel now and more about vaccines. The Prime Minister continues his conversations with CEOs of vaccine manufacturers, as do colleagues and officials within the Government of Canada. As the global race for the supply continues, Canada is on track to receive its full doses. And come September, every Canadian who wants a vaccine will receive that vaccine. We will have news about Moderna next week. And the numbers, the Prime Minister acknowledged that the numbers will fluctuate. As the global supply picks up, there will be more stability. Before the end of March, Canada will receive 2 million doses, and we are on track to ensure that there are 10 vaccine doses available for Canadians based on the procurement strategy we have embarked upon. Now, I know there are a lot of little people and not so little people in our community who are back in school. And let me thank the teachers, the staff, and so many who have worked to ensure that that is possible. The Prime Minister announced the agreement, part two of the Safe Restart Agreement. All provinces and territories have reached an agreement. A Safe Return to School Fund will roll out the second phase of federal investments worth $1 billion so that our schools are safer, so that there's sanitizer, ventilation, online learning supports, and additional supports for remote classes. We understand this is provincial jurisdiction. We will always respect that, but we will be there to support provinces and our schools and our kids for as long as we have to until we get through this. Many thanks to teachers and educators who are going out of their way in these very difficult times to teach our kids and our youth really important lessons about strength, resiliency, and kindness. Those lessons are going to last a lifetime, and we appreciate you. Our community, and I've received a lot of letters about this locally, when Joyce Echequan died, there was an additional push for all of us to do more to address systemic racism in our healthcare systems. Yesterday, the Government of Canada heard from leaders in Indigenous communities and across the country about ways to address and prevent racism that hurts too many in our care systems. He announced the beginning of a co development of a distinction based health system with Indigenous communities and recognized that it is high time to address systemic racism in our health systems. And I look forward to working locally with Indigenous leaders to ensure that this community's voices are included in that agreement as it begins to be formed. On gender based violence, every province and territory has agreed to move forward with the first action plan, national in scope, on gender based violence. We know there are many women and children and folks living in abusive homes right now, and that rates of violence online and offline have increased. It's not okay. There are resources available if you are not safe, and we are moving forward to ensure that we arrive at a day when no one in Canada has to say me too. Lastly, 5 years ago in January, the local mosque in Peterborough experienced a horrid act of hate and violence. There was an act of arson at the masjid, at the mosque locally, that was deemed a hate crime. 4 years ago, there was a shooting in a mosque in Quebec City, and it took the lives of many worshippers and left 17 children orphaned. Anti-Muslim terrorists exist in Canada, and we will always remember and honor all victims of that horrible night and those who are left to mourn them. Moving forward, January 29th will be the National Day of Remembrance of those victims and a day to act to fight all forms of hate, including Islamophobia. I know I took a lot of space today, colleagues, but there was a lot to talk about, and I'm happy to hand it back to you now, Sarah, and I'll be available for questions.
Thank you so much, MP Monsa, for that powerful statement and reminder. So now we're going to move on to MPP Dave Smith.
Thanks, Sarah. I'll be very, very short because Dr. Salvatore has to leave in 8 minutes. Stay positive, test negative.
Great words. Thank you so much. Now, I did see that MPP David Pacini is on the line. Is there anything you would like to add?
No, thanks very much. Thanks very much for having me. I would just echo what Dave said, and obviously we remain diligently working with all levels of government to get the vaccines in the arms of Canadians, and I'm very pleased to see the first images of residents at Fairhaven, into expanding into the riding that I represent as well. Just today, images from Golden Plough Lodge. So across the wonderful communities that we represent, the very nervous residents are now getting the vaccine in their arms, and we're working closely and accelerating the delivery for those most vulnerable, and look forward to more supply coming to Ontario so that we can get them in the arms of those who need it most. So that's it. Thanks, everyone, and as Dave said, stay positive, test negative.
Thank you so much for joining us today. So we're going to move on to Mayor Diane Therrien. You might potentially be muted, Mayor Therrien. Nope, that's okay. Okay, so I believe that's all of our elected officials. So we're going to move on to the question portion, and I would like to start with Paul Rellinger. Please just remember to let us know who you're asking the question for.
Thanks so much, and I'll be very brief. Dr. Salvatierra, a couple questions very quickly. On the reported death, can you provide any details? Man, woman, in a home, private residence, age, anything?
What I can share, Paul, is that this was an individual who lived in a congregate setting in the community, but who died in hospital earlier this morning.
Okay, so clearly there's no need to declare an outbreak at that congregate setting at this point.
I mean, there's nothing new that we need to do at this point. This person has had COVID. We've been aware that this person's been ill. And so I think all the appropriate actions have been taken from the public health perspective.
Okay, and then the only other question I had regarding the new outbreak, a relatively new outbreak at Peterborough Retirement Residence. Can you tell us staff, residents, how many people or what the status of that is?
I can. Let me just look up what I knew as of end of day yesterday. I believe we have a staff case there, if I'm not wrong. Total of 3 staff. They've been testing, and I know we've had lots of negative results which have been coming in, which is great. And that they are receiving some support with infection prevention and control from PRHC, who's assisting.
Great, so 3 staff altogether then, so.
I believe so.
Okay. Okay, thank you, Dr. Salvatierra, appreciate it.
Thank you, Paul. I see that Meritarian is on the call. Would you like to add any remarks, Meritarian?
Hi, sorry, I thought I was on, but I don't think you could hear me. Not much, because I know Rosanna has to go. Just wanted to flag once again the extreme cold that is going to be facing our community over the next couple of days. So for folks to be conscious of when you're outside using the skating rinks or getting physical activity, that there are going to be very frigid temperatures. The warming room overflow space will be open extended hours for folks who need it. And please contact social services if you need assistance with housing or with finding warm spaces to be over the next couple of days. Just wanted to flag that. Thank you very much.
Thank you, Meritarian. Okay, I see Joelle has a hand up. Can we help you, Joelle?
Yeah, I just wondered if Dr. Salvatierra would like to, I don't think you said whether it was man, woman, or age in the latest death.
Oh, for the latest death. I don't have that information, Joelle.
Okay, fair enough. Next person.
Thank you, Joelle. We're going to move on to Taylor Clydesdale.
Hi, thank you. I'll try to make this very, very brief. Actually, just a question of clarification. You said 4 homes had been vaccinated. I just didn't catch the last home, the one in Norwood.
Oh, that was Pleasant Meadow Manor.
Pleasant Meadow Manor. All right, thank you. Maybe you can go into a little bit of detail about what is the thought process behind which long-term care homes are receiving the vaccine first and in what order.
Sure. Our staff use a number of criteria to rank order our long-term care homes. So for example, we conducted infection prevention and control risk assessments in each of our facilities earlier in the pandemic. So we take that into account. We also take into account the history of outbreaks in that facility, not only past COVID outbreaks, but also other respiratory or gastrointestinal outbreaks for the past 2 years. And then once we've done that, we try and strike a balance between city facilities and those facilities in the county. So that's how we come up with the list of what order we're going to do the homes in.
And I know, I just got a notification on my phone this morning that there was another delay with the Moderna vaccine. With
Yes.
the vaccine delays that Canada has been facing, does that change the prioritization order of anyone in the Peterborough community?
I wouldn't say it's changed the order. It's certainly limited what we could do. I think when we first hoped to go out with vaccine, we were hoping that when we went into a long-term care home, that we could do all the staff and the essential caregivers at the same time. And that hasn't been possible. We've had to focus in on just the residents, and we've had to focus in on just our long-term care homes. We have COVID outbreaks going on right now in Peterborough in our retirement homes as well. We also have our congregate living settings for seniors are also impacted. We would like to be able to do all congregate settings for seniors, and we just haven't been able to because we haven't had enough vaccine. So as soon as we get a better flow of vaccine, we'll be able to expand those groups that we currently are able to take vaccine to now.
Okay, that's perfect. I think that's the only question I had. I'll leave some time for my other colleagues. Just for Sarah, there was a slide in there showing the vaccine distribution, the long-term plan. If it's possible to get that slide sent out to media, that would be greatly appreciated. Thank you.
Yes, of course. Sorry. So we will move on to Matt Latour.
I've got nothing.
Awesome. Dr. Salvatore, are you okay for a few more minutes?
Yes, I could stay. I'll stay a few more minutes, and then I'm sorry, I have to excuse myself.
Perfect. Okay, so Jessica Niznik.
Hi, Dr. Salvatera. I'm wondering why all 500 doses weren't given to residents. You're saying 43 of them were given to staff.
Yes, so once a vial is punctured, we're not allowed to move it. We can walk it to another part of the facility, but we can't put it in a car and drive it back to the freezer or the fridge at the hospital. So we are obligated to use it. So what's happened is that whenever we go into a long-term care facility, first of all, we only take enough vaccine for the number of consents that we have. But when we get to a home, sometimes for whatever reason, someone may not be immunized, even though they had a consent form. And so the long-term care facility has a list of their staff that they can call in because they're the next group we'll get to. So what we don't want to do is we don't want to waste any doses. And I'm just so proud of our teams. We have not wasted a single dose. In fact, we've actually had more doses by using a small syringe. We've been able to extract 6 out of the 5. No, sorry, I think it's 11 out of the 10 because they come in different sizes. So we've actually been able to get more doses and we've been using them all up.
Okay, but so that means you haven't had 100% compliance, like consent, sorry, not compliance. You haven't had 100% consent.
We haven't had 100%. And what we're also finding, I think as well, is that there are empty beds in some of our long-term home facilities. So even though when we report by number of beds, we might have a bigger denominator, when we actually go into the home, there may not be as many. And then of course, there will be some for whom we don't get consent or for whom there is a contraindication, so they can't be immunized.
Okay, thank you. And just one last question. When you say serious adverse effects, what does that mean? And will those residents get a second shot?
So serious means that they actually required medical attention, potentially in hospital for a period of time. And the decision about whether or not they get a second dose really is a medical decision that's made either with their own healthcare provider. Sometimes I can adjudicate on that and determine whether or not there's a contraindication. And sometimes it actually requires a referral to a clinical immunologist. It actually may even require to have that second dose done in hospital where there is more capacity to respond if needed. So there's a lot that goes that's considered for people who do react to that first dose, and careful consideration is given towards whether or not they can or should have a second dose.
Thank you. And just the last question, the 43 staff that got it, which home were they at?
That's a combination, Jessica, across all 4 homes.
Perfect. Thank you so much, Dr. Salvatierra.
You're welcome.
Thanks, Jessica. And Joelle, I see you still have a hand up. Do you have some more questions?
Well, sure. Is the Pfizer vaccine still expected, or are we going entirely with Moderna?
We are hoping to get Pfizer. We haven't been told yet when that will happen for Peterborough. I think the province is still waiting to receive confirmation on Pfizer shipments and allotments. So we're keeping our fingers crossed, Joelle, that sometime in February we will start to see Pfizer here in Peterborough.
And when's the next shipment coming to start those other long-term care facilities? Did you say the week of the 8th?
No, so the next shipment is Moderna, and we've been told to expect Moderna by the earliest by February 5th. So it is a delay. We were hoping to get it February 1st, but we learned yesterday that that Moderna has advised that the shipment won't be arriving until the 4th into Toronto, and then hopefully, fingers crossed, the next day here in Peterborough.
Isn't the 5th the deadline, though? Like, are you going to be a day past that?
Nothing gets by you, Joelle. That's correct. The 5th was supposed to be the deadline. We were hoping to get all of our long-term care residents immunized by the 5th. I'm just going on to a call now at 12:30 where I would expect that deadline will have to be revised given what we've now learned about the Moderna shipment.
Okay, thanks.
You're welcome. So I will excuse myself, but please, I hope you continue to have a good media briefing, and I'll see you again next week. Bye-bye.
Thank you so much, Dr. Salvatierra. So that goes through all of the media that I have. Does anyone else have any questions or comments? No? Okay, well, thank you. Oh, sorry.
Is Chief Carr still there? Can she talk about when she's expecting her community to start receiving vaccinations? They're high priority.
I see. Oh.
Hi, Joelle. We are unsure right at this time due to the delays in vaccines. What I do know is that our health workers are working with Peterborough Public Health and Curve Lake First Nation, and we're working on the process, our plans of when we can roll out. I can't give you a definite answer. We are hoping on calls that I was on yesterday, we're hoping that all our First Nations will be done by the end of March. Right now, we're more concerned about our seniors. We know that the vaccines are for long-term care homes and residents and health workers. And so we are trying to advocate for our seniors who are in our communities. You know, as if any of you have been in a First Nation, you know, we are a big congregate setting, and you know, we're always out with each other and helping each other out. And so we have seniors, but they may not be in long-term care homes, but they do require long-term care. And so we keep our seniors home as much as we can. And so we're trying to advocate for those seniors to be able to be included in that first part of the rollout of vaccines, because they do have high, they have other complications. And so we're right now we're just more specifically working to try and get that done while we work on the bigger plan of a complete rollout for our communities.
Okay, thank you. That's really helpful. I'm done.
Thank you. Thank you so much. I think that adjourns our media briefing today. Thank you all for joining. And hopefully you have a wonderful weekend, and we will see you all next Tuesday. Thanks very much.
Thank you.
Bye, everybody. Have a good weekend.
Thank you.
Bye-bye.
Bye.
Bye.
Have a great weekend, everyone.